Director for the Upper Midwest Telehealth Resource Center. Thanks for joining us today. On our end today, we also have Luke Wortley, and we will hear from him a little bit later on. And then Autumn Daniels is behind the scenes managing our chat and technical issues for us. So thanks, everyone. So today we're just going to talk about some basic telehealth stuff. We're not going to do a deep dive into anything. This is for folks that are newer to telehealth and everything that's going on with COVID and the public health emergency and all the many, many changes we've seen over the past several months. So if you're new to the Upper Midwest Telehealth Resource Center, we cover 4 states. We are a regional telehealth resource center, and we cover Illinois, Indiana, Michigan, and Ohio, so these lilac states here. We're part of a national consortium. There are actually 14 telehealth resource centers around the United States, and we're all federally funded through HRSA, the Health Resources Services Administration, and the Office for Advancement of Telehealth. So you see the 12 regions across the United States, and then we have the 2 national centers, one for policy and one for technology. We do have a national website, and we host a monthly telehealth webinar series through that national website. There's also an interactive map where you can reach out to any of the regional or the national telehealth resources through the website. And then we have some handouts and other basic information. Here at the UMTRC, I like to call myself a virtual librarian. When people ask me what it is that I do for a living, because we do, even before COVID, we do a lot of things virtually. We have our website where we host a lot of resources, and people can contact us. If you fill out the contact us page on the website, you're probably going to get Luke on the other end. We do have an 800 number, and then we do lots of events like these, the virtual office hours, and monthly webinars, and quarterly stakeholder calls and monthly newsletters, so that you can reach out to us in a variety of different ways. So we do have our website, as I mentioned, and we have a Facebook page and also a LinkedIn page where you can follow us. And about us, this is most of the team that put together our virtual conference in July, and how you can reach us on our website. So I mentioned events. We've got lots of events coming up this week. It's a busy week, but we try and keep any events in our region that we know about, as well as national events that are telehealth related. We try and post those on our website so that you can know what's going on within the realm of telehealth. I mentioned our resources earlier. We have COVID-19 resources that we stood up earlier this year, and a whole host of things to help with some of the basics for getting started with a telehealth program. You can also sign up for our newsletter that usually comes out at the beginning of each month, and that's where the link there. We will send out these slides. We're also recording today's event, so Autumn will make the slides available and the recording available through our archived webinars and through our YouTube page within a couple of days. So at the federal level, some really high level information about reimbursement for telemedicine. Telemedicine at the federal level through Medicare is reimbursed based upon CPT codes or HCPCS codes. But prior to COVID-19, in order to be reimbursed for telehealth, the patient had to be in a rural census tract or a health professional shortage area. Now with COVID-19, that has been waived during the public health emergency. And let's see, today we're at the 17th. So 2.5–3 weeks ago, the CMS came out with the proposed fee schedule for 2021, And there's lots of congressional action going on about a bill to change those site restrictions for Medicare to be permanent, but it will take an act of Congress to make that permanent. CMS cannot alter the federal code, which defines those rurality and site restrictions without congressional action. At the state level, each state has their own Medicaid program. All 50 states and territories in the United States do have coverage of some sort for telehealth and telemedicine under Medicaid. Each state does have a little bit of leeway. They are able to tailor their Medicaid programs as they see fit for their specific state or territory. This is just a snapshot of the annual CMS Medicare Learning Network, or MLN, fact sheet. The link over here at the side will take you to that fact sheet. Every year they put this out based on the new physician fee schedule, and it includes a list of the different services by description and by CPT or HCPCS code. It also has information in it, links to billing resources, to the telehealth resource centers, and other things. Within our region, I want to take a quick look at the different state Medicaid programs. So we have created on our website state telehealth reimbursement summaries. And these include links to the Medicare telehealth fact sheet that I just showed you, as well as links to the Medicaid department where you can find the bulletins as they make changes, and what the private payer laws are for each state. So that's the basic, gives you a basic idea of what coverage is like for your state, and links to get more information. At this point, I'm going to turn it over to Luke. He is one of the lead grant writers within the Indiana Rural Health Association, where our telehealth resource center is housed. And he's going to talk about a little bit more, some general resources for grants and where to find data, that type of stuff.
Great, Becky. Do you mind if I just tell you next slide? Okay. So the first thing that I wanted to talk about is, in case you're not familiar with it, one of the best places to start looking for grants, at least at the federal level, is grants.gov. This gives you ample opportunity to use all of their filters and their search function, some more advanced searches, or even if you just type in single keywords, something like just telehealth even, it'll come up with everything that's both forecasted and currently out in terms of a notice of funding opportunity. Depending on the agency, they use different languages, but all the federal funding resources can be found there at grants.gov. If you're looking for other funding opportunities that aren't federal, let's say that you want to start a smaller scale project or aren't really interested in working with the federal government, my suggestion is to look at the state level, and even sometimes community foundations at the county level have small resources available, like somewhere in the neighborhood of $2,500 to $10,000, depending on the size of the community. And if you're in a metropolitan statistical area, then of course sometimes those larger municipalities have even larger resources. We're just generally used to working with smaller rural communities, and so those small scale grants are something that we're more familiar with at the state level. And then finally, if you're going to work with a private foundation, which generally tend to fund very specific initiatives depending on the interests of the board and their stakeholders, then you're going to have to go through a different process altogether, where you'll actually submit just a proposal first before you're even able to actually write a full grant application. So I just wanted to give that little brief overview of where you find funding opportunities, and then we can go on to our next slide. And then when you're actually in the thick of writing a grant application, one of the best places to go in terms of national, state, municipal, county. I mean, every single level of data that you can possibly think of is the Census Bureau. A lot of states have their own data aggregators, but a lot of times they generally end up just pulling data from the Census Bureau. And so I included a link here for the quick facts, which just give you basic demography, and they go from the federal level all the way down to the county. And even some larger townships and mid-sized cities even have pretty up-to-date information on the Census Bureau. But the reason why I also included the Census Bureau is because you'll be able to navigate from there to the Bureau of Labor Statistics. You'll be able to check out small area insurance estimates, stuff like that, where you're looking for the real nitty-gritty facts that help correlate to social determinants of health, right? When you're writing a grant application, you want to make sure that you're not just presenting the numbers. You want to make sure that you're looking at those numbers and saying, well, here's the correlation with the specific thing that I'm trying to apply for, right? And so you may notice, wow, in my community, there are a lot of people, a higher concentration of people who are age 65 and older. And you might be writing for a telehealth grant and that might not tell you much on the surface, but if you start to look at the disparity in terms of access of technology, in terms of like connectivity, but also just sheer device literacy, that might tell you a much more in-depth story. So I always start at the Census Bureau just to see, what does my community look like? What, who am I actually serving? Before I really get down into the nitty-gritty of what health disparities are going on, what are some of the other things that are related here? You can go to the next slide here, Becky. And then the first thing that we always do here at the Indiana Rural Health Association, and I think it helps inform the rest of the grant application process and make it go a lot smoother, is before we do anything, we have to have a draft of the work plan. It's all well and good to have a great idea, and it's also all well and good to have potential partners lined up. That those are all great starting places and key foundational building blocks. But a lot of those things have to be informed by the work plan, because if you don't know your scope of work and your actual concrete things that you're going to be assigning to your partners, then you don't really have a productive conversation in those initial contact meetings, and you can't get letters of support or memoranda of understanding. So I genuinely suggest that you start with the work plan, and it can be something as simple as this. I pulled one from HRSA here. This is one of their samples. You can make this as complex or as simple as you need it to be. They always say that no plan survives first contact with the enemy, right? And I kind of apply that to grant writing, in that no great idea survives first contact with the work plan, right? Because as soon as you start really putting pen to paper and seeing which year and which quarter you're trying to get all your activities done in, it might change the scope of your idea drastically. So I genuinely recommend starting with the work plan. You can go to the next slide there, Becky. And then if you're really kind of stumped on where to go after the Census Bureau, one of my favorite resources to at least get a starting point, sort of the Wikipedia of grant research sometimes, is the Kaiser Family Foundation. As you can compare statewide data with national trends, and you can actually see kind of like where the top 10% of performers are, where the bottom quartile of performers are. And the Kaiser Family Foundation tracks all kinds of information. We're talking broadband access, we're talking hospital readmissions, we're talking, many health topics that the CDC's data portal is very good at looking at, but it's not nearly as accessible, in my opinion, as the KFF website is. So those are just a few resources that I like to use to get started on grant applications. And maybe if we have some time at the end, if anybody has any specific questions about the application process or following that funding opportunity or the request for proposals, we can get into it then. Oh yeah, finally, and then your State Department of Health. Every single one of these I've linked to their data dashboard. Some are a little bit more user-friendly than others, but for the most part, you should be able to at least type in keywords. in the search function to be able to map out at least some baseline data. And most of these also have like separate links that will take you to the latest reporting. Keep in mind, if you're relatively new to the grant writing application process, that these numbers will always look a little older than the actual year that it is, just because state and national statistics tend to be anywhere from 2 to 3 years behind, just in terms because of the rigorous level of analysis and fact checking that it goes into to actually churn out those reports. So anything for 2020, you're probably going to be looking at the latest end of 2018 or early 2019 data. So I'm going to pass it back to Becky just to give us one more pass at our contact information and then open it up for questions if we have time.
Yeah, absolutely. So there's our contact information if you need to get a hold of us. And Autumn has also put the info at umtrc.org in our chat. So we got about 10 minutes left for our half-hour virtual office hours, and we'll open things up for questions.
Hi, Luke. This is Sue Brammer from Ohio, from the University of Cincinnati. Just off the top of your head, do you know of grant opportunities for telehealth, particularly telemental health, that are out there?
So because we're a resource center, we don't really get into the provider end of telehealth as much. So we haven't been keeping our finger on the pulse of telehealth development grants or anything like that as of late. But I'm pretty sure that there are a couple out there that are related to suicide prevention in an emergency care setting. And then I think the next round of evidence-based telehealth network development program will have a mental and behavioral health component to it. And I'm not exactly sure when that's forecast off the top of my head. The last one came out 2 years ago, Becky, so it should be in the next year or so.
Yeah, if you go out to that grants.gov, you can do keyword searches. You can look at things that are forecast. You can also sign up for the newsletters as new things come out. So it's a huge resource for
I actually just typed in telehealth at grants.gov, and there is one related to suicide prevention and emergency care that's come directly out of HHS, specifically the National Institute of Health. And then another one, digital healthcare interventions to address the secondary health effects related to social, behavioral, and economic impact of COVID-19. I expect to see as the public health emergency is extended or lifted, either way, to see a lot of specifically COVID-19 earmarked funding for telebehavioral health, as that seems to be one of the biggest points of access for many isolated citizens in both rural and urban communities. So I regardless of what what uncertainty is out there, I think one thing that we can be pretty confident in is that telebehavioral health is going to be mainstream.
Okay, thank you.
Great question. Any other questions? And you should be able to unmute yourself, or also you should be able to send us a message in chat. All right. Autumn, is there anything else we need to let everybody know about today?
No, just please take your time and look at our website also. And if probably tomorrow, everybody who attended today's session is going to get a thank you for joining us, and also a survey that we're going to request that you be able to submit to us, just basically letting us know how you're doing, how our platform is working out for you, about signing in and such questions like that. And I look forward to seeing your results. Of course, it will be anonymous when you submit it, and it just allows us to track and be able to perform more efficiently in the future.
All right. Well, thanks everyone, and have a great week.
Thank you.